feed infants with critical congenital heart disease. Let's say that you have a baby with a hypoplastic left ventricle, and this baby has just been diagnosed, and the baby has been started on prostaglandin. Would you feel comfortable feeding this baby using the gastrointestinal tract? I see some hands going up. Okay. Very interesting. There's many people who absolutely will not feed a baby right away with interrupted aortic arch, hypoplastic left ventricle.
Pristine.
Why? Because they are afraid that those babies are not going to send blood to their gastrointestinal tract. And those babies do have higher incidence of ischemic bowel disease, okay? But feeding does not seem to play a role here, and I'll show you some data that supports this. So here's just some of the rationale. Congenital heart disease represents an increased risk for neck, and I put neck here in quotations because this is not the same, quote, neck that we see in our premature babies. This is ischemic bowel disease, lack of blood flow that causes this. Cardiogenic ischemia, there's diastolic steel, there's decreased mesenteric oxygenation, and there's also PGE effects that could affect the bowel. So there's wide variations in practice. So here's one study that was done in Scandinavia, and the title of this was Low Risk of Necrotizing Enterocolitis in Enterally Fed Neonates with Critical Heart Disease. And this was an observational study. This is very difficult to do, doing a prospective randomized trial. So I think we have to rely on some of these observational studies. But this study showed no increase in adverse outcomes if you fed these babies, if they fed these babies using the gastrointestinal tract. And here's another one. And this is feeding neonates and infants prior to surgery for congenital heart defects, systematic review and meta-analysis. And the conclusion of this study was very similar. No association between neck and preoperative feeding status in neonates awaiting cardiac surgery. So I think we should begin to feel a little bit more comfortable in putting food into the gastrointestinal tract of these babies with congenital heart disease, even hypoplastic left ventricle, coarctation of the aorta, and interrupted aortic arch. What about during blood transfusion?